But the argument is that by forcing healthy people to buy into health insurance, that the cost of health insurance for the whole decline, which means that it gets easier for us, all of us as individuals, to buy that health insurance. Right? And then, of course, Obama's the second part of that plan is after you force people to do it, there's some people who just will not be able to do it. Right? So you subsidize those people so they can buy in. But the idea is to insure everybody, which theoretically should bring down costs for everybody. That's the idea. Now, there's a lot more going on in the bill than just that, but that's the main kind of gist of the strategy, right? And the hope he has is that it'll bring down health insurance costs for you in the long run, and hopefully in the short run. Okay? But that's the plan. Now, whether it will work, I do not know.
So you mentioned, well, first of all, we established that health insurance costs are getting higher exponentially, and especially in the United States where it's higher than every place else. And you mentioned, these things that are driving up, the people living longer and all of that. And at the same time, you're mentioning the idea that, it's this auction. And, whoever is paying the most will get it. So people want to pay progressively more and more. Which one do you think in our system is the driver of that? You seem like, two different ideas. Is it the system itself that we have that is driving it up, or the, I guess, material, people actually wanting more high-tech healthcare?
Okay, so what I'm trying to say is one way of characterizing, thinking about what I'm trying to say, is that there's two questions here, right? One is, these lines are going constantly up. The other is, there's a distance between the blue and the red line, right? What I'm arguing is that the problems that we started this discussion with, right, of the increasing elderly population, ecological transition, those kinds of increased technological, those things are driving the slope. They're driving the line up, right? The cause of the distance is the price fraction, right?
You were talking about earlier how the invisibility of price rationing kind of hides and masks, or the nature of it just kind of masks that. And do you think that it's becoming less and less invisible? There was that famous report that was it 45,000 people die a year in America without lack or because of lack of access to health insurance. So do you think that increased visibility of the nature of price rationing is making that even more unsustainable as something that can be defended by private health insurance?
I don't think of it that way, because I think that the problem that poor people don't have access to health care has been a problem for years, right? And Roosevelt's talked about this during the Great Depression, right? So the fact that there are people who don't have access to health care and that causes them to die, I think is not something that people are unaware of. What I do think is changing is that population is growing, right? And it shows you that, right? The percentage of people who don't have access to private health insurance is growing. And so that, and also it's not simply growing amongst the poor, right? Increasingly it's not a poor person's problem. And a lot of you are going to learn this, and I guess if Obama's right, you won't learn this, right? But is that it was increasingly becoming a middle-class problem. And that changes the political dynamics of what's going on, right? When the poor people can't get health care, I think you can make the argument, as a lot of people did, right? Well, that's just, that's the nature of the thing, and that's, and poor people, in their response to this, were making this argument, you need to give me health care, right? Which is, you need to give me is always kind of a weak argument, right, politically. But when that group increasingly starts creeping up into the middle classes, right, then that argument becomes more potent, more powerful. Right? But still, the perception amongst the public is kind of, well, I think the perception is quite mixed, right? Everyone thinks the bill is terrible and they're all mad, right? Although all polling data that's ever been done on the United States suggests that the majority of Americans, pretty strong majority of Americans, support the idea mean, that question that's one of the first polling questions that was done in America. Right? Do you support national health care? People have always said yes.
Is there insurance in England?
There is, the British system is what we call National Health Service, and so the government provides health care directly for free to its citizens. So in Britain, you go to the doctor and you get health care, and that's it. There's no bill, there's no price, it's just free. It's a government service. I mean, that's of course, it's far away from the American system as you can get. It's the most kind of nationalized, state-centered system. And that system is incredibly cheap. It's one of the cheaper healthcare systems in the world, not the world, but in the advanced capitalist countries.
Since your area of study is more focused on other countries, and you've obviously taken a look at the systems in these other countries, I know you probably don't want to say maybe in this manner, but if you had to say which country,
my favorite?
Sure. I mean, I was going to say most efficient, quote unquote, whatever efficient means, but I think we've set a bar for efficiency and what we think we need to.
Oh,
So.
what I think what's the most efficient? Well,
Yeah.
That's better than the question.
That's why I wanted to
favorite.
say efficient.
All right. I can answer that. That's much easier.
I mean, if you want to say your favorite.
No, I don't want to say my favorite.
Okay.
No. I think, to me, it seems quite obvious that the most efficient system is the National Health Service of countries like Britain, right? And lots of people complain about Britain because it has waiting lines and the like, right? And it does, and it has its problems, no doubt, right? Although I would argue that that's not a problem if they have equal access. It's a problem if they don't spend enough on it, right? But I think, to me, there is no doubt that the British healthcare system is providing the most bang for the buck of any healthcare system in the world, amongst the advanced countries, right? That in terms of just pumping out healthcare per dollar, the British system is kind of hands down the best system.
I guess am I allowed for a follow-up question?
Yeah.
All right. I guess my biggest question, I guess with this whole entire debate has been going on for how long now, recently, is that I don't know if it was in one of your classes, but we heard the quote where it's like, okay, the United States is the only country where the majority of the population does not vote for things that will benefit the majority of the population, or one of the few countries. And I guess my question is, from the the political statistics part of your background, why do you think it is that, I mean, like we have the Tea Party people these people are just angry that there's a healthcare bill, and they don't know what's in it, but they're just angry that the government is interfering and taking it wherever they think. So why do you think it is in the United States that so many people are so adamant, supposedly, or so against legislation that would expand access to the majority of the population?
Okay. You're asking kind of...
Or am I asking a loaded question?
No. Yes, but it's just probably go off in my face, not yours. So, the first thing is you're saying, why is it the majority of Americans vote against their own interests, right? That's the first part. And I just think that's not true. I've never seen any evidence of this. People argue this all the time, that people vote against their own economic interests all the time. Well, I mean, partially, making that argument suggests that you understand people's interests better than they do, right? And it's hard for me to argue that when people vote Republican or whatever, that they're voting against their own interests. I mean, they're voting against my interpretation of their interests, right? But I don't prioritize their interests the way they do, nor do I necessarily interpret how things will go down in their way. And maybe I'm smarter than them and I know what's in their interest, but I'm less comfortable about saying that, right? I don't know, for people on the left and the right, they're not as they're perfectly comfortable with making that argument, but I'm not. So I'm not willing to say that I think people do vote against their interests. I don't know that that's true. Now, I do think that people do vote for national health care. I think the argument that people do not vote for national health care is simply empirically false. Many elections have been won historically in the United States on national health care, right? I mean, the New Deal was very popular in the national health care elements of that bill were very popular, right? Oh my goodness, now I forgot his name. I forgot the president's name. Truman, thanks.